what happens to the loose skin in your neck after you do liposuction? So oftentimes I have patients who are inquiring about liposuction. They're worried about the skin underneath the neck becoming loose or saggy. And it's a difficult question to answer because it's really patient specific. And what it really boils down to is many times is just the elasticity that you have in your skin. And that elasticity, for the most part, is determined certainly by your genetics, but also age. People who are younger, let's say younger than 40, tend to have a little bit more elasticity in the skin itself. So when you do the liposuction, that skin is going to contract. And when it contracts, because of the elastic nature of the skin, it tends to flatten out a lot better and look more uniform. Now, I've had patients, let's say 55 and older, who are wondering, hey, can I just get liposuction? And oftentimes I have to be honest with them, tell them no, because what ends up happening is many times, not only do you have excess skin, but the muscle, again, the platysma, which we've talked about before, is lax. So that needs to be addressed. And that's when you kind of need to focus more on a neck lift. Now, when we're doing a liposuction, you're essentially, making incision underneath the chin. And it's very small. It's maybe 2 millimeters. And then what we do is we follow along the bottom of the jaw or the mandible. And then we also come out here to the side where the sternocleidomastoid muscle is, and then feather across. The result you get here is to be predicated upon, one, how much elasticity you have, and then two, also, where your anatomy is. And what that has to do with is where your thyroid or your Adam's apple and your hyoid bone sit. Those that sit back and up, you're going to tend to get a much acuter, more refined look, whereas people whose anatomy sits a little more forward, the skin can only contract to that area so far as the anatomy itself. And obviously, with everything that I'm discussing, if you have any questions, give us a call. I think that helps out a lot when you're able to talk to either myself or my patient care coordinator. We're able to kind of guide you and give you an idea as to what to expect. And obviously, we'd love to see you as a patient because there's no substitute for actually physically seeing somebody in person to give you the best assessment. So I hope this makes a lot of sense regarding liposuction and addressing skin elasticity. Feel free to leave us a comment so we can respond to you.